You know, we talked the other day to a doctor about something that we had not really thought about very much, and I think it was a bit of a revelation to all of us, Natasha, right? The idea that so many people who are now coming down with COVID, with the Omicron variant, don't even know that they have it because the symptoms are so mild. People think it's a cold or it's allergies, whatever it happens to be, and don't recognize that they have it and therefore don't test, and therefore become a problem because not knowing you have it and not isolating means you're potentially perhaps transmitting it and getting other people sick, right?
And then there's the issue of, like, I always come back to the example of my mom, who we believe got COVID very early on, before vaccines and testing wasn't even available at that point, and now has become a long hauler, right? And those symptoms coming and going and the brain fog, and there's just so much unknown when it comes to this virus.
And to that was a story today, actually, a large-scale study, and I think that's important to note here. So this is not about a couple of, thousand people. The study involved 1.28 million patients.
Wow.
And it's telling us now that basically what we're seeing is a higher risk of brain fog and psychosis as well, and that's after 2 years, more than other respiratory illnesses. Dr. Matthew OUGHTON is on the line. He's an infectious disease specialist at the Montreal Jewish General Hospital. And Dr. OUGHTON, thank you for your time. Appreciate it.
Good afternoon, Aaron and Natasha.
Can we address this? Because this is, everything is alarming when you read about after effects of COVID, but it's a giant study, and the news is a little disconcerting.
It certainly is. I guess I'll start by saying that there's still so much that we are trying to define when it comes to the long-term effects of COVID. A study like this is certainly an important step. It's not the final answer by any means, for several reasons that I'll get into in just a couple of minutes, but it really does help quantify what kind of effects we can reasonably look for, and at least gives us some directions or points us in some directions. Some of the strength of this particular study that was published in one of the Lancet journals, which is quite a reputable general medical journal. So as you correctly pointed out, they looked at the database records of about 1.3 million people with COVID-19, and particularly important is that they actually compared this against a similarly sized group of people who had respiratory infections but not from COVID. And the reason that's important is that at least gives you a pretty good comparator to be able to sort of pick up some of the more subtle signals, because some of these events that they're talking about in the neurologic and the neuropsychiatric sequelae are not things that happen at a very frequent basis. So you need to have both large numbers and a fairly sensitive way of picking up elevations above chance. So they've constructed this database well. This actually looks at everything from young kids all the way to the elderly, and across many different countries. It's a very United States heavy database, but they also incorporate, this database has many other countries. I think there's Australia, United Kingdom, and something like 8 or 10 other countries on top of that.
The word I think that troubled me, brain fog is something that we've heard, with regards to COVID and also long haulers. Psychosis, that's the first time I've personally heard that word in relation to this virus. Can you explain what's going on there, Dr. OUGHTON?
So I'll start by saying that I'm an infectious disease doctor. I'm not a psychiatrist. Yes. I'm not a neurologist. A lot of things I'm not. But one of the issues, so this was originally suggested actually quite a while ago, relatively earlier on in the pandemic. But again, it's going back to what I was just saying about having such a large group with such a large control group is what lets you start to pick up relatively rare events like this. One of the things that I think this study advances us on is it makes it fairly clear, because a lot of these records, they had data on patients over the course of 2 years, right? So kind of longitudinal data, not just snapshot one-time kind of data. And as a result, they're able to point out that this is not just a delirium, which can often happen, particularly in elderly patients, when you are acutely sick from whatever the cause, whatever the underlying cause is. It's not just that. There seems to be something separate that actually can lead sometimes to pretty significant neurologic issues, including psychosis, also in both in adults, but particularly in children. Even seems to be an elevated risk of epilepsy and of seizures. So there's a lot of hints here. I would say that for any one of these, dementia and psychosis, I think it's pretty clear that this isn't the end of the road here, this study, but this points us in those directions. And I think then this would support doing more detailed studies with more granular data on, more closely addressing maybe a smaller number of these diseases, because one of the challenges in dealing with these huge databases, almost 1.3 million cases, is that those databases are very good at large numbers, but they don't give you that granular kind of individual level data. A lot of the rough edges get sanded off, which means sometimes you miss some of the nuances because you're dealing just with sort of disease codes and just broad classifications rather than sort of fine level data.
I'm wondering, as you see a story like this, and it's 2 years down the road, we're so concerned with focusing on now and treating this if you come down with it and what you have to do, right? 2 years down the road, I wonder how many of these people even remember, A, that they had COVID, or if these symptoms can actually be attributed directly to COVID. And I would guess that, the fact that seems kind of vague so much longer after the fact that you had it, make it even difficult to diagnose that tying them directly to COVID.
That's you're absolutely correct. Let alone, as you mentioned during the prelude to this, so many people can have an infection where there are the symptoms are so minimal that you might not even get tested. So there's a lot here, and these kinds of studies at least advance us in trying to understand what consequences might arise. Supporting the next sort of more refined levels of studies, but we're talking now about an infection which at times, I'm thinking, for example, back around in last winter when we had sort of Delta running around, and then a few months later we had the first of the Omicron variants running around, and in many provinces, we saw numbers ranging from 30% to, I seem to remember Manitoba being an example, where in one of these waves, they estimated that over half of their population was infected. Mm-hmm. So when you think about these massive numbers, even rare events individually multiplied by such a huge number still means that this, you can see the concern where you're worried about having still a relatively large increase in previously rare events when you have such an easily transmitted and widespread infection.
I feel like there's a great sense of complacency that has set in, despite the fact that the numbers are still not great, that people are not going to get their booster shots. Vaccination is way down. I'd love to hear from you, Dr. OUGHTON, what you're seeing in your practice right now at the Jewish General Hospital.
It's an interesting word to use, complacency. I think for some people, I think that's the case. I think some people just don't see what the big issue is, they don't see any reason for particular concern. Maybe that's a better way of putting it. Mm-hmm. I would say other cases, not exactly complacency, but it's this chronic sort of level of anxiety and feeling of helplessness. They don't know what to do because this pandemic just seems to be ongoing, and when it changes, very rarely does it seem to change for the better. So I certainly am seeing both of those approaches on sort of the individual level. I certainly find it both interesting and a source of some frustration that despite the data that we have showing how useful our current batch of vaccines are at protecting people at least against the more severe consequences, here in this province, similar to what we've seen in pretty much every other province across Canada and every territory, we have this sort of almost flat line for people taking up boosters. And there's a whole bunch of reasons beyond that, and you really need to speak to people who are experts in sort of messaging and almost like social psychology to understand, I think, a lot more of this. But it's certainly been frustrating that we only have about, I think the latest I saw was 56% of the Quebec population that can be vaccinated that have even gotten their first booster. let alone further boosters beyond that. Yes, I'm very glad to see that the province has seemed to have, this week, they've been announcing new initiatives trying to get people to get another booster if it's been at least 5 months. I suspect and I hope that this is in preparation for the next generation of boosters, the so-called bivalent boosters that were just approved for use in the United Kingdom, and hopefully we will see those same bivalent boosters approved for use here in Quebec and elsewhere in Canada, hopefully in the next few to several weeks, because I suspect once that new generation comes with its better ability to protect people against Omicron and many of the subvariants, I'm hoping you will see a renewed interest in people getting a vaccine because they'll feel that it's more relevant to what's going on in terms of the circulating variants.
No, it's interesting to hear you use the word frustration. Whoever would have thought that, you had to massage the message to convince people to take a vaccine for a disease like this, but that's in fact what we've run into now, right? That's the hesitation. How do you get the message across? Because as you just said, at 56 or 57%, apparently too many people have decided they don't want to hear about this anymore, which is, I guess, incredibly frustrating as a medical professional.
It's a challenge because the very same virus poses very different risks to different people, right? You'll have someone who is older, who has a few chronic health conditions, and for them, the virus poses a much higher risk than for someone who is relatively young and healthy. Even here, though, looking at a study like this one that we were chatting about, when you talk about, for example, doubling the risk of seizures, of epilepsy in children, when you're talking about such a widespread infection, that's not a benign effect. The common belief that children simply don't get affected anything significantly by this infection, certainly I think needs to be re-examined when you see some of these more severe effects across a broad population.
Dr. Oughtton, we want to thank you for the time today. We do appreciate you taking it to join us. Thanks so much.
It was my pleasure. Have yourselves a good weekend.
You too. Matthew Oughtton, doctor over at the Montreal Jewish General Hospital. And imagine the frustration, right? You have something you want people to take, it works, and you're still getting this pushback now, even this late, from people apparently just not that interested anymore.